Hello ladies, this is Amy Koo, pharmacist health coach. I'm here today on Harmony's mainstreaming menopause conversation platform to answer a question for you. The question is, why do I have trouble sleeping after menopause? I used to sleep so well. And worse yet, I now have restless leg syndrome. Well, this is not uncommon. According to Johns Hopkins University Sleep Disorder Center, trouble sleeping is very common amongst menopausal women. In fact, 61% menopausal women suffer from some sort of sleep disturbance. And the most common sleep problems reported by women going through this phase include night sweats, insomnia, obstructive sleep apnea, and restless leg syndrome. So why does this happen? See, around menopause, of course, you know our ovaries stop producing estrogen and progesterone. Both of these hormones are involved in many bodily processes that affect our mood, our appetite, our sleep, sex drive, and many other things. And for example, progesterone may affect breathing drive. So the lower level of progesterone now may contribute to sleep apnea and associated sleep issues. Estrogen plays a role in the metabolism of serotonin and other neurotransmitters that control our sleep-wake cycle. Estrogen also helps keep our body temperature low at night and therefore more conducive to sleep. Estrogen also has antidepressant effect. Now, we have less estrogen in our body after menopause, so of course, we're going to experience a whole myriad of issues along with that. Of course, on top of that, as we get older, our sleep-wake cycle also changes and loses consistency, so we begin to feel tired earlier and wake up earlier, and leading to less sleep overall. Lastly, we could be at an age where we're getting some joint pains and body aches, and we start taking medications. And unfortunately, some of these medications could also interfere with sleep. So what do? Some women find herbal supplements that address menopausal symptoms to work very well for them in terms of insomnia. And other women find magnesium to work very well. As you know, magnesium is a mineral. If you're going to take magnesium for sleep, you may want to try magnesium glycinate. Glycine is the amino acid that's attached to magnesium to help your body to absorb it. And glycine happens to also have a calming effect on the brain. And for restless leg syndrome, try topical magnesium chloride spray. It's also known as magnesium oil. So magnesium chloride solution is easily absorbed through the skin and relaxes the muscles very quickly. There are some other things we can do as well. For example, try to maintain a healthy weight. As we know, higher body weight is associated with obstructive sleep apnea, and women tend to gain weight after menopause, again because of the hormonal imbalance. We can try to eat at least 2 hours before bedtime and avoid trigger foods like a large meal, spicy food, or acidic foods that may trigger hot flashes. Of course, avoid caffeine and alcohol late in the afternoon and early evening because these substances can definitely disrupt sleep pattern and sleep quality. Use the restroom before going to bed to avoid waking up throughout the night. And stop drinking water maybe a few hours before going to bed. That might help. Reduce stress as much as possible. Anxiety and stressful thoughts can keep you up at night, making it harder to fall asleep. And keep your bedroom temperature comfortably cool. Lower your bedroom's thermostat to around 18 degrees Celsius. As we mentioned earlier, cooler temperature is more conducive to better sleep. And follow a regular sleeping schedule and go to bed waking up at the same time every day if possible, and avoid napping if you can. Especially if you're going to nap, try to nap less than 20 minutes. And as anything longer than 20 minutes could potentially interfere with your sleep at night. Now, if your sleep issues persist, consider working with a therapist trained in cognitive behavioral therapy for insomnia, and perhaps one who's had experience working with menopausal women. CBT is a proven treatment for insomnia.